turn on my mic because it works. Yes, awesome. Is this too loud or is it good? Can you guys hear me if I speak like this for the rest? A little bit louder? How would I make this louder? Okay, that's okay then.
Yeah, I would just talk louder.
Cool. Okay. So, I'm going to make this louder by talking louder. But yes, welcome again. You can find my review session at ucfstudyunion.wordpress.com. Okay, so you can get this there, and you'll get your answers here. Okay. Any questions before we begin? No? Cool. Okay, so let us begin. So, which of the following is not a function of the nervous system? Okay? Is it A, receives input from outside and inside of the body? Okay, are we going to receive input from outside and inside of the body? Is it responsible for red blood cell production, calcium storage, and endocrine regulation? And let's remember this not here, right? So, like, is it not responsible for blood cell production, blase, blase? And is it not a process and interprets sensory input? Or does it not dictate in response by activating effector organs such as contraction? Okay, this one should be fairly easy, right? Has nothing to do with red blood cell production. Who can tell me what is involved with red blood cell production? I heard bones, a little whisper over there. Anything else you guys want to add? We also have our kidneys, right? They secrete erythropoietin. Y'all remember that? You know? Let's try and remember. You know, I understand it's the final and we want to focus on just like the small information, but the entire class is important for our entire future. Okay? So like, even when we're done with the class, you know, and you failed or whatever, you passed, don't forget to look back at your notes, okay? So I looked through my notes not just because I was an SI leader. I started SIing for anatomy last summer, but I used to look at my notes even the spring before and the years before that after I took my class, just to keep it fresh in my mind, okay? But yeah, so essentially it will not be responsible for red blood cell production, calcium storage, and endocrine regulation. And if we were to look at this, the answer would be bones, right? Neuroglia are excitable cells that transmit electrical signals throughout the body. True or false? False? Awesome. Anyone disagree? Nobody disagrees? Cool. So, indeed, it is false. Okay? And we could actually find this on page 581. So, just a remark, like, I'm going to be telling you guys where you can find the pages and stuff. Up to number 35, okay, it's going to be 4th edition. But after 35, so 36 and onward, it's going to be, what's it called? 36 and onward, it's going to be from the 3rd edition. Because I made those questions, these ones I kind of got from Shelley. And she used the 4th edition to make these questions, okay? So up to 35, 4th edition. After 35, 3rd edition, okay? Just to let y'all know. Now let's match the following cells with the corresponding description, okay? So the smallest and least abundant phagocytes, they're macrophages of the CNS. Are those going to be astrocytes, oligodendrocytes, microglia, ependymal cells, satellite cells, or Schwann cells? And yeah. So what do you guys think? Anybody? We're going to see that A, so smallest and least abundant phagocytes, macrophages of the CNS, are microglia cells. Does anyone disagree? No? Cool. Okay. What cells produce myelin sheaths in the CNS? Schwann? Awesome. So we'll go Schwann, and that's part B. Does everyone agree? Yeah? Well, we'll actually find that the Schwann cells produce myelin sheath in the PNS, okay, the peripheral nervous system. So this is C, and the oligodendrocytes will produce the myelin sheaths in the CNS. Okay? So we found C. Let's skip to D then. Well, actually, let's read C just to get like the whole story. So surround axons in the PNS. They form myelin sheath around axons in the peripheral nervous system. Okay, so those are our Schwann cells. Then D is the most abundant glial cell type. They take up and release ions to control the environment around neurons. Okay, what would you guys describe this one? D. Astrocytes. Awesome. Astrocytes. Anyone disagree? No? Well, you're correct. What about those cells that line the central cavity of the spinal cord and brain? So we're left with ependymal and satellite cells. Okay? Satellite cells, right? So, I'm sorry. Line the central cavity of the spinal cord, we have the ependymal cells. Then that gives us our satellite cells surround the neuron cell bodies with ganglia, okay? You know, just like satellites surround our Earth, these satellite cells surround the neuron bodies, okay, with their ganglia. Any questions? No? Cool. Okay. And just, you know, to inform those who didn't know, UCF won, okay, the championship. But moving on. Which of the following nerve layers consists of delicate connective tissue that surrounds the axon? Is it the perineum, the epineurium, the nerve fascicles, or the endoneurium? Okay. Oh, and just to, we can find these on page 585 of the 4th edition, right? But moving on to the next one, we'll find this one on page 585 as well, okay? Because we're still talking about nerve layers. What do you guys think? D? Awesome. Yeah. So we have the endoneurium, okay? We have the endoneurium. Number 10 states that the withdrawal reflexes are example of polysynaptic reflexes. Is this true or is this false? Like withdrawal reflexes. What's a withdrawal reflex? Right? Like, let's say I'm walking, you know, and there's a big fat nail, and I step on it. I wear like skater shoes, so they're thin at the sole, and they poke my feet. I'm like, ah! I withdraw my foot. Okay. Is that going to be a polysynaptic reflex or not? Yeah. Awesome. Okay. What defines a polysynaptic reflex? Any idea? Afferent and efferent. Awesome. So we're going to have like more like synapses, like two, going one and one going in. But like essentially with stuff like that, it just hits the spinal cord and it's done. You know, like we kind of, what's it called? The reflex occurs before we even know it occurred, kind of thing. Yes. So number 11. Which of the following cranial nerves provides both sensory and motor innervation? Okay, is it the olfactory nerve? Is it the accessory nerve? Is it the facial nerve? And then option D is actually the vestibulocochlear as well. so is olfactory both? Yay or nay? No, right? It's just sense of smell. Accessory nerve, both or no? No, just motor, right? Shrugs our shoulders. Trapezius muscle, right? Facial nerve. Yeah, so we have a little bit of taste, we have some feeling, and it innervates our what muscles? Face muscles, right? His facial nerve innervates our face muscles, okay? So we'll see it's our facial nerve. And vestibulocochlear, it deals with sound and balance, okay? So it deals with sound and balance. Moving on to the next page. We see our vestibulocochlear option over here, but we know that's not it. Which of the following is not a muscle of the palate? Okay, so this one should be important for you guys. Is it the palatopharyngeus? Is it the stylopharyngeus? Is it the uvulae muscle? Or the levator villi palatini? Okay, so is it the palatopharyngeus? So not a muscle? No, right? The stylopharyngeus? That one, right? Okay, so when I think of the word stylus, it connects to like the stylus process in the back. And that, like we have our palate up above, or this, the stylopharyngeus kind of like connects out laterally. Okay? But yeah. Awesome. And then the uvulae muscle, that's like the one that goes into our, uvula, which is pretty cool. But continuing, we see number 13 asks, which condition results from failure of the maxillary and medial nasal processes to fuse? Do we have mumps? Do we have silolithiasis? No? Do we have cleft palate? Yeah? Or is it cleft lip? Who says cleft lip? Raise your hand. Cool. Good. Not cleft palate, cleft lip, okay? And if you want to like confirm that with the book, they have like page 560 and 563. And the previous one was page 558, okay? A child is brought to the hospital after developing a rash characterized by red spots with white centers. Excuse me. The mother reports that the child has had a persistent fever accompanied with excess mucus production. Upon examination, the physician notices that the child has started to develop a mild case of conjunctivitis. What is the most probable diagnosis? Measles, awesome, yeah. So that should have been identified with the red spots with white centers. There's also a test. I have a question later. Yeah, so that white, that red with white, that spot is the Koplik spot, okay? So you should know that name as well. It's a later question. I'm just kind of telling you guys now, because when we get to that question, I expect y'all to answer it out like no tomorrow, okay? And just in case we don't get there. I made this review longer than the others. But number 15 states that we didn't do that one. A patient presents with polyps of the GI tract and melanocytic pigmentation of the lips and oral mucosa. Okay, so melanocytic pigmentation, what does that mean? Of our lips. Anyone? Any idea? Who knows what a melanocyte is? Yeah? Awesome, awesome. So, yeah, we'll have increased production of melanin from our cells. Okay? And we'll also see it in the oral mucosa. Okay? So not just on the lips, but inside as well. Which of the following conditions is associated with these symptoms? Okay, is it Addison's disease, Peutz-Jeghers syndrome, aphthous ulcers, or is it the herpes virus? Okay, this one's a tough one. Okay, all of these, diseases are tough. B, awesome. Peutz-Jeghers syndrome. Okay, awesome. Which of the following structures is not a part of Wildayer's ring of lymphoid tissue? Okay, is it the pharyngeal tonsil, the tubal tonsil, the laryngeal tonsil, or the lingual tonsil? Okay, actually, let me just, page 569. And that's the same, so page 569 here. So yeah, not a part of Welder's ring of lymphoid tissue. Okay, who's familiar with Wildayer's ring of lymphoid tissue? Cool, a couple of you guys. Okay. That might be something you want to get familiar with. But yeah, we'll see that the laryngeal tonsil is not a part of it. Okay, the laryngeal tonsil is not a part of it. Which nerve carries the general senses such as pain, touch, and temperature from the posterior third of the tongue? Okay, is it going to be cranial nerve 9? Okay, what's cranial nerve 9? Who can name it for me? Pharyngeo-glossal, does everyone agree? What about cranial nerve V3? Okay, so the third branch. We have our ophthalmic, mandibular, maxillary. Okay, so here's our maxillary nerve. Okay, and this is kind of just a little study tip. If they give you all these Roman numerals for your cranial nerves, sometimes I just like to write them out. Okay, I remember, I think when I took the final, since I had so much time, like at the back, I just listed them all out because I kind of remembered the cranial nerves from a list. So I went and I did my list, and I did like sensory, motor, both, and all that pajazz and whatever, and I referred to it as needed while taking the test. Because sometimes, like, after reading a couple questions, or like, working for an hour, like my brain gets a little tired, and it's good to have those things to refer from. But yes, you have the answer? Three, mandibular. Oh, V3 is mandibular, not maxillary, right? Because that's your mandible. This is your maxilla. Awesome. Thank you for fixing that. So we have our mandibular. Mandibular nerve. Okay, and then cranial nerve 10 is our, big V, right? So vagus, and then cranial nerve 7, we've already talked about in one of the previous problems, is which nerve? Awesome. So what innervates the posterior third of the tongue? C, the vagus nerve. Does everyone agree? Not quite, right? Vagus nerve kind of goes down and innervates like GI stuff and whatnot. So let's take a look at something else. Is it the facial? No? What is innervated by the facial? Anterior 2/3 of the tongue. So this is anterior 2/3 of tongue. So we'll cross that off our list. Our mandibular? No, maybe so. Not quite, unfortunately. Our mandibular does innervate around that region, but it's mostly, like muscles and whatnot around there. We'll actually see our pharyngeo-glossal innervate the posterior third. And looking at the name, it's like the pharyngeal / tongue. Okay, so like that posterior section where the pharynx meets the tongue. Okay, and that's how we're going to remember the posterior 1/3 of the tongue is innervated by the pharyngeo-glossal, aka cranial nerve 9. Okay, number 18 asks, which of the following nasal structures does not drain into the middle nasal meatus? Okay, so if you look at page 576, you will find your answer. Who has an idea? Nobody? Well, we'll see that our posterior ethmoidal cells do not drain into do not drain into the middle nasal meatus, okay? Our frontal sinus will have an exit into it. Our maxillary sinus will have an exit into it. And our anterior ethmoidal cells as well will kind of drain into theirs, okay? And, you know, you can read up in this page to get a better picture of what's going on, okay? Any questions? That was a little weird question. I'm not even going to lie. The posterior ethmoidal cells, that is a good question. I'm not sure. The superior. So this one goes into the superior nasal meatus. Meatus. Okay, that's not legible. I apologize. But you guys get the idea, right? Any other questions? Number 19, okay. Which nerve innervates the tip of the nose? Okay, the ophthalmic. Awesome. Yeah, I always get tricked up. Sometimes I want to think the maxillary. But if you look at the answer choices, we have like cranial nerve 7, the facial nerve, and then the 3 branches of 5. Oh, just kidding. Cranial nerve 1, which is the olfactory. So that's so it's not the olfactory because that's exclusively sensory, okay, and it has to do with sensing smell, right? V1, which is our ophthalmic, is our correct answer, and then if we look at V2, you know, sometimes you might get tripped up because the mandibular nerve is really close to our nose as well, but yeah, that was a good question. That's a good question. Especially with the options, they're all pretty tricky. Anyone else have questions? You can find this on page 577. Okay, 577. And our answer again is the ophthalmic nerve, aka cranial nerve 5, but the first branch. Which of the following conditions is characterized by a pinkish gray color focal thickening of the mucosa due to edema? A, nasal polyp. Spectacular. Anyone disagree? No? Cool, neither do I. Neither do I. And neither does my answer key. But moving on, which of the following muscles is not an extraocular muscle? Okay? So extraocular, right? Outside the eye. Which one is not an extraocular muscle? Is it the levator palpebrae superioris? That's it? So it's not that one? Or is it, so that means it, superior rectus is an extraocular muscle? Lateral rectus is an extraocular muscle, and superior oblique is an extraocular muscle. This is a particularly easy question if you're not familiar with the levator palpebrae superioris, because you know for sure that these are all extraocular muscles, right? And you can use, you know, exclusion to identify the correct answer. Yes, number 22. Which nasal meatus do the tears drain into after passing the nasolacrimal duct? C, the inferior nasal meatus. Spectacular. Any questions on that? Which of the following structures does not pass through the cavernous sinus? Okay, is it the ophthalmic artery? Is it cranial nerve 3? Is it cranial nerve 5? Or is it cranial nerve 4? Okay, so cranial nerve 3 being the oculomotor, cranial nerve 5 being our trigeminal, and then cranial nerve 4 being, what do we say, the trochlear? Number 4 being the trochlear. Number 5 being the trigeminal. So is our, does not, okay, so which one does not pass through the cavernous sinus? You guys think it's cranial nerve 5? No idea? Any idea? It is in fact our ophthalmic artery, okay? Ophthalmic artery. And we'll get this on page 661. The previous one, page 657, page 656. And if you want to look at this one, we got page 577 as well. And we haven't reached number 35 yet, so it's all 4th edition. Okay. Just for those who's come in late, I also have like a evaluation form, kind of like that you can fill out at the end. They should be on the tables, but if not, you can kind of come up and get one. Or if you do have one at your table, you can just fill it out and leave it there. I'll come grab it at the end. No problemo. But yeah, just letting y'all know. Those are to help out study union for next semester. Number 24 asks, which chamber or chambers of the eye contains the virtuous body? Okay, so is it the anterior chamber, the interior chamber, the posterior chamber, or both the anterior chamber and the posterior chamber? Okay, so the virtuous body. Not the virtuous humor. Awesome. B, our interior chamber. Does anyone disagree? No? Cool. Okay, so our virtuous humor is a little bit all over the place. Don't get confused with virtuous body. What structure is found in the second layer of the retina? Okay, well, we have our nerve axons, our bipolar cells, our rods and cones, or our ganglion cells. Okay, you might get a little confused because it doesn't ask like, from deep to superficial or what, or orientation. But B, so we'll have our bipolar cells. Awesome. Does anyone disagree? If we look at it, yeah? Ganglion cells. Awesome. So we'll have our ganglion cells as our answer, okay? And what I was just going to elaborate is we want to look at from like the bottom, okay? So the second layer, like the first layer being, what's it called? That going to our optic nerve and then going out from there, okay? Does that coincide with ganglion cells being the second? Oh. Yeah, so this problem, it's a little hard because you got to look at orientation, right? And it doesn't really describe orientation too well, unfortunately. So either or could be good, but according to my according to the answer key, I have ganglion cells as the correct answer. Okay, but yeah. Which of the following conditions results from impaired drainage of the aqueous humor from the Schlemm's canal, or the canal of Schlemm? Okay, is it cataracts, papilledema, glaucoma, or color blindness? Glaucoma, right? Learned about that in middle school. Okay. Which of the following structures is found in the middle ear? Okay, are we going to have the auricle, the auditory tube, our bony labyrinth? Okay, so that's the next one. Or our external acoustic meatus. So what's going to be in the middle ear? Is it going to be our auricle, our auditory tube, our bony labyrinth, or our external acoustic meatus? This one should be easy, right? Which one is it not? So it's not our external acoustic meatus, right? That's like right in our skull, by our brain almost, okay? And that's like inner than our inner ear, okay? So we can cross that out. What about the bony labyrinth? Where do we find that? Outer ear, inner ear, middle ear? Inner ear, right? So we can cross that out. The auditory tube, where's that at? That's pretty much all that's in the not all that's in the middle ear. We have those bones and whatnot, like the stapes and etc. But we have the auditory tube, which kind of connects. It's also called our eustachian tube. Okay, so if this was defined as our eustachian tube, we might have been more familiar or like ready to name it. I apologize, my handwriting's really bad. Like, my handwriting's really good at like 9 a.m. and then slowly it gets worse and worse throughout the day. But yeah. Any questions on that? Cool. And what's our auricle? Right? Yeah. It's like the outer ear. Okay? And then here's our other two options, bony labyrinth and external meatus, which we know are not it. But number 28 asks, which of the following nerves innervates the superficial muscles around the auricle? Okay, so the superficial muscles around the auricle. Are we going to have cranial nerve 7, which is our facial nerve, cranial nerve 5, our trigeminal nerve, cranial nerve 10, which is our vagus nerve, or cranial nerve 4, which is our trochlear nerve? 7, awesome, yeah. And you know, you can get this off page 671 and this page 672 for the previous problem. Okay. Number 29 asks, paralysis of which cranial nerve causes loss of function of the stapedius muscle and a loss of sound dampening, leading to hyperacusis. Okay, so hyperacusis is like just everything is too loud, you know, like you feel like you're at a rock concert just talking on the phone or something. But yes, which cranial nerve causes this loss of function? So paralysis of which nerve? Is it cranial nerve 7, cranial nerve 8, cranial nerve 4, or cranial nerve 11? 7 as well? So we'll see 7 back to back. Does everyone agree? Yeah? Well, you are correct, okay? And then you can get this on page, actually, you just have the PowerPoint, so you skim through your PowerPoint for that one. Which of the following structures is not a part of the vestibular system? Is it our saccule, our utricle, our semicircular ducts, or the scala vestibule? Okay, so this is not part of the vestibular system. So, you know, if I go surfing, what's not helping me? C, D, the scala vestibule. Does everyone agree? Yeah? Well, you are correct. Okay, so, and we'll see this on page 676. Okay, 676. Blood is supplied to the uterus by the uterine artery, a branch of the external iliac artery, and the ovarian artery. True or false? False. Which one of these is not supplying our uterus? The external iliac artery. Okay? Awesome. You know, and you can find that on page 338. Which of the following does not provide ligamentous support to the uterus. The round ligament, the cardinal ligament, the sacrocervical ligament, or the ovarian ligament. Okay, this should be easy, right? Who says A? Who says B? Okay, a little bit of B. She says no. Okay, what about C? No? What about D? Awesome, you're correct with D. Good guess on cardinal ligament, because it sounds very unfamiliar. Okay, if I didn't know and I were to guess, I would guess that one too. But the uterus wants to be fairly protected. It has a lot of tape. Okay, ligaments are tape, and one of those is the cardinal ligament. But you can also see that the ovarian ligament will provide support to our ovaries, and our ovaries are actually not like fully connected to the uterus, right? Dr. Sampson was talking about if we were to put in a dye into the uterus and we see that dye through X-ray does not go into the rest of our body. Okay, if it happens to stay within the fallopian tubes, then that's a malformation. Okay, we would actually in a healthy female, that dye would leak through the fallopian tubes, past our ovaries, into our not pelvic cavity, our abdominal cavity. Right? But yes, again, we can see this on page 338 as well. Okay, page 338 as well. Still for the 4th edition. Once we make that jump to number 36, so the next page is going to be 3rd edition from now on. All of the page numbers I give you, okay? I apologize, for the switch up, but I didn't want to go through all of the first ones just to make them 3rd edition, and I don't even have the 4th edition myself, so yeah. Which of the following conditions is characterized by inflammation and infection of the fallopian tubes, which may lead to loss of the epithelium and sterility? Okay, would that condition be lymiomas? Would it be an ectopic pregnancy? Would it be salpingitis? Would it be Stein-Leventhal syndrome? Okay. Which ones could we get rid of? Cake. Okay, which ones would be easy to get rid of? Ectopic pregnancy, right? That's just, having a little embryo growing in the wrong place. Lymiomas, what's that? Yeah, tumor, okay? You see myoma, you think tumor, okay? And this, tumor won't be inflammation. We'll have, the growth of something, okay? And instead of loss of epithelium, tumors are essentially just like an overgrowth of a specific epithelium in our, no yawning. You're making me yawn. What's it called? I don't even know what I was talking about. But the answer is salpingitis, okay? And we can find that on page 336 and page 338, okay? I was talking about tumors. Essentially, they're just an overgrowth of the same type of epithelium, okay? So, instead of a loss, we'd see like an overaccumulation of that, And Stein-Leventhal syndrome, I'm not even sure what that is. Does anyone know what Stein-Leventhal syndrome is and would like to share with us? Awesome. So hormonal disorder, high LH, low FSH, Variety of signs, symptoms, one of them including cysts, right? Or was we'll see follicular cysts. Cool. Yeah. Awesome. So actually on that same page, page 336, we'll see that as well. Okay. What is the site of lymphatic drainage for the scrotum? Is it the sacral node, the superficial inguinal node, the common iliac node, or the deep inguinal node? B, superficial inguinal node. Does everyone agree? Well, you are correct. It is the superficial inguinal node, okay? Superficial inguinal node. Yes. Usually when we're talking about lymphatic drainage of like the lower pelvic area, I usually think of inguinal nodes, whether it's superficial or deep, because that's like a big site, a huge site of lymphatic drainage. If you look at a diagram. But yeah, moving on. Which of the following is not a content of the broad ligament? Okay, I could tell you now this is going to be an important question. I definitely know all of its contents, and yeah. So which is not a content of the broad ligament? Is it the suspensory ligament, the uterine artery, the sacrocervical ligament, or the fallopian tube? Excuse me. Sacrocervical ligament? Awesome, you're correct. So the answer is C, sacrocervical ligament. Okay? Sacrocervical ligament. Everything else will be a content of the broad ligament. Excuse me. Which of the following is not a content of Alcock's canal? So another content question. I've been told Dr. Sam likes these. Okay. Which of the following is not a content of Alcock's canal? Okay, is it the pudendal nerve, the internal pudendal artery, the internal pudendal vein, or lymphatics? D, lymphatics, okay? So we'll see that the Alcock's canal will have the pudendal nerve, the internal pudendal artery, and vein, okay? Yeah. Sorry, I just left my water here. Just trying to hydrate. Oh, this is a fun question. The urgency of micturition typically occurs at approximately how many milliliters of urine? 100? 200? Yeah? 300? Or 400? So not 100 and not 400. You know, when we say approximately, we'll look at the average. My answer key suggests 300. But if you look in the book on page 322, I think I remember it saying from like 250 to 320, okay? So, you know, like approximately would be in between that, which is 300, okay? Okay, and again, this is third edition now. Third edition. We passed number 35. So from here on out, all of the page numbers that I give you will be third edition. Which of the following is the fetal remnant of the allantois? Okay, this is a tough question. Okay, is it the medial umbilical fold? Is it the round ligament of the uterus? Is it the median umbilical fold? Or is it the Gardner's duct? C, the median umbilical fold. Anyone disagree? Well, you are correct. It is the median umbilical fold, okay, not medial, okay? That's a tough one, you know, like when they have those tricky, you know, wordplay there. But we'll see it's the median umbilical fold. Who knows what the allantois is? No idea? Anybody? Essentially, it's like, you know, in the embryo, it helps, it's like this kind of layer, okay, of tissue that helps handle like gas exchange for certain things, and just like deals with liquid waste. So like it'll filter out, you know, good and bad things, you know. It's not super important for your knowledge, but knowing like what it becomes is important, okay? Any questions on that? I just want to thank you guys for coming. I know it's late. Thank you guys for coming. Without you guys, Sark wouldn't exist. You're welcome. But please limit the yawning, because like y'all are really making me tired. Okay? I just saw like 3 people yawn at the same time, and if I wasn't talking, I would have yawned. Okay? But which of the following muscles does not help form the pelvic diaphragm? Okay, C, iliopsoas. Good stuff. Does everyone agree? Does everyone agree? Okay, cool. Which of the following is the fetal remnant of the Müllerian / or, AKA paramesonephric duct? Is it the prostatic utricle? Is it the seminal colliculus? Is it the Gardner's duct? Or is it the Wolffian duct? Which one can we get rid of right away? We can get rid of the Wolffian duct because that's another like original structure. It doesn't develop. Like the Wolffian duct develops into 2 things. Just like the Müllerian duct is an original structure and develops into things, right? So which one's a fetal remnant of the Müllerian paramesonephric duct? A, the prostatic utricle. Awesome. So that's for males, right? What about for females? Huh? The uterus. Pretty much the uterus with the fallopian tubes. It's like the, I think in the book he wrote it as, the primitive female reproductive organ tissue or something like that. But yeah, so like all that stuff. Prostatic utricle. Which part of the male urethra is most prone to injury? Is it the preprostatic? Is it the prostatic? Is it the membranous? Or is it the spongy? I see someone's got number A or letter A over there. Does everyone else agree with A? No? What do you guys say? Huh? C, the membranous. You're correct. It is membranous. Okay, so the membranous urethra is most prone to injury, okay? And we can get this on page 326. Okay, and just to kind of like catch all up, the last one what was it, page 326 as well. Yeah. Cool. Disregard that. So I'm going to smack you guys with a couple of epithelium questions. Okay, so let's see who knows their epithelial layers. What epithelium is found in the seminal vesicles? Is it stratified columnar? Is it pseudostratified columnar? Is it simple cuboidal? Or is it pseudostratified squamous? So it's not pseudostratified squamous, it's pseudostratified columnar, okay, for the seminal vesicles. Where do we find our seminal vesicles? Anyone? In our heart? Find anything with the heart, okay? But maybe that might be something you guys want to look up, okay? What epithelium is found in the vagina? Okay, you guys should remember this from previous section, right? Is it simple squamous? Is it simple cuboidal? Is it non-keratinizing simple cuboidal, I meant? Yeah? So I'm just going to, let y'all know it's not simple squamous. Okay. So the vagina, question mark. Non-keratinizing simple cuboidal, pseudostratified columnar, or non-keratinizing stratified squamous? D, right? So it's non-keratinizing stratified squamous, okay? And that's similar to like our mouth and esophagus, right? I don't know why, that was always easy for me to remember. What epithelium is found in the fallopian tube? Is it simple ciliated columnar, non-keratinizing simple cuboidal, pseudostratified columnar, or non-keratinizing stratified squamous? What do you guys know? Now what do you guys think? What do you guys know? I know you know this. Raise your hand if you think it's A. Okay, a couple of you guys. Raise your hand if you think it's B. Okay, a little bit less. C? Rock on. D? None for D. Okay, so we're kind of tied between C and A. Okay, so drum roll. The correct answer is A, simple ciliated columnar. Okay, and this one we could get page 340. The last one was page 341. Just to kind of like, keep the love. The seminal vesicles you can find on page 328. Okay. And again, 3rd edition. Final epithelium question for you guys involving repro. What epithelium is found on the surface of the ovary? Okay, is it simple ciliated columnar? No? Is it simple cuboidal? Yeah? So that means it's not pseudostratified columnar? And it's not non-keratinizing stratified squamous? Awesome. So it is, in fact, simple cuboidal, okay? And, just to kind of paint the picture a little bit, it might not look like it. It'll look rough, okay? Especially in older women. And it'll look scarred, okay? Just from time. Rupturing all the time and whatnot, doing their business. But yeah. Where do the majority of prostate cancers occur? In the transition zone of the prostate, the central zone, the peripheral zone, or the median zone? You know, this one's kind of like you know it or you don't. So I heard B, central zone. No? C, peripheral zone. Awesome. Okay. And this is talked about in page 330. Previous one was page 332. Number 47. Damn, we're flying through these problems. Which of the following is homologous to the Bartholin's gland? Okay. So is it the Cowper's gland? No? Is it the paraurethral gland? So it is the Cowper's gland, right? No. Oh, sorry. Bartholin's gland, Cowper's gland, prostate gland. So it's not the prostate gland, it's not the greater vestibule, and it's not the bulbourethral gland? Or it is the bulbourethral gland? It is the Cowper's gland. Okay, Cowper's gland, awesome, good stuff. So not the bulbourethral gland. What is homologous with the bulbourethral gland? Isn't it both? They're synonymous. Right? So they're synonymous. They're the same thing. Awesome. Okay. What I did when I took the class, I just made a chart, right? You know, like I'd have male, female, and what's it called? Fetus. So I'd have like like what it was in fetal life, what it becomes in a male, and what's homologous in a female, and then I made just like a big chart like this, and use that to remember all this stuff. And it was super helpful. But yeah, so we see that it's both the Cowper's gland and the bulbourethral gland because they are synonymous. And you can find that on page 332. This one on page 332. And this one will be on page 331. And this one asks which one's homologous to the prostate gland. B, right? Paraurethral gland of Skene. Okay. Number 49 asks which of the following is the most common case of ovarian enlargement in pregnant women. Okay. Which of the following is the most common cause of ovarian enlargement in pregnant women? Is it leiomyomas? No. Is it luteal cysts? Yeah. So that means it's non-neoplastic ovarian cysts, nor follicular cysts. Awesome. Which one is the most common, you know, in all women, not just pregnant women? C, non-neoplastic ovarian cysts. You're correct. But in the case of pregnant women, we'll see it's luteal cysts. Okay, luteal cysts. 50 asks which of the following is not true. Pardon. Just give me a second. Okay. Which of the following is not true of the proliferation phase of the menstrual cycle? Okay, so the proliferation phase. Is that phase 1, 2, or 3? No idea? We'll see it's actually phase 2. Okay, so phase 2. In phase 2, will we see ovulation? Yeah, like at the very end. Okay, so like right before the proliferation phase ends, we'll see ovulation. Will it be days 5 through 15? Yeah, it'll be days 5 through 15. Is it controlled mainly by progesterone? False, right? It's going to be mainly, controlled by estrogen, okay? And our following phase, phase 3, will be primarily controlled by progesterone, okay? So our answer we can see is C. And thus, it's good to know that our proliferation phase is accompanied by an increase in body temperature. Any questions? No? Cool. Okay. So, which of the following directly drains the left ovarian vein? Okay, is it the left renal vein? Is it the left gonadal vein? Is it the left, not the left gonadal vein, sorry, just gonadal vein. Is it the gonadal vein, the portal vein, and then the last one, so I don't have to turn the page, is internal pudendal vein. Okay, so this one's kind of tricky. We have like asymmetry in the body here. Like the right side doesn't do the same thing as the left side. Okay, those always kind of mess me up. I like to remember one side, not two sides. But you got to do what you got to do, right? Okay, and we see here that the left ovarian vein is actually going to drain into the left renal vein before going into the IVC. Okay. Right? Is that correct? And you can get that information on page 334. Okay? Page 334. And this last one was page 337 in the 3rd edition. Which of the following results from an abnormal closure of the processus vaginalis? Okay. Which of the one results from an abnormal closure of the processus vaginalis? We actually talked about this in one of my opal sessions, if you remember. So will it be hydrocele of the cord, hydrocele of the testes, cryptocortism, or miscarriage? Which one can we get rid of? Miscarriage, right? That's wild, okay? So we'll see processus vaginalis closing in males only, okay? And very few males can have children. Cryptochitism, is it that? No, it's cryptochitism. Okay, I felt a couple of whispers at me. I'm going to assume those whispers said failure for the descendants of the testes. Okay, so we have cryptorchidism, which is the failure of the descending of the testes. We'll still have dissension of the testes with processus vaginalis. So like how it kind of works is like our testes will go down and like create kind of a canal type thing, and that's our processus vaginalis, and then it closes to create some ligament thing that I forgot what it is. But if it fails to close, we won't see a hydrocele in the testes because the testes are down here. We'll see a hydrocele of the cord, which is where our processus vaginalis is located. Okay, so the answer is hydrocele of the cord. And we could find that on, I don't have a page for it, unfortunately. Any questions on that? No? Cool. Okay. Which of the following is the deepest layer found in the scrotum? Is it our dartos fascia? Is it our cremaster muscle? Is it our tunica vaginalis? Or is it our internal spermatic fascia? C? Okay. I heard a C, but it sounded a little uncertain. Does everyone else agree? Well, you are correct. Okay, so we have tunica vaginalis as the deepest layer. You might like get confused with internal spermatic fascia. You know, you see internal and you're like, oh, that's the most deep, but you gotta be careful, okay? Know your scrotums, okay? We'll see. Tunica vaginalis is the deepest one. Number 54, what are Koplik spots indicative of? Yeah, thank you. One of y'all remembered, okay? Measles. But just going back, you can see the layers of the scrotum on page 347. Which type of mechanoreceptor detects vibrations? Do we have the Meissner's corpuscle? No? The Merck's disc? Or Merkel's disc? I think I forgot an L there. Yay or nay? For B. No clue? What about C? Pacinian corpuscle? A couple of head nods. Okay. Seem a little uncertain. So that means it must be the Ruffini endings? No, right? We'll see that it's C, the Pacinian corpuscle. Okay, page 591. And I apologize if I butchered the pronunciations of those. But yeah, page 591. That is the end of my review sheet, but not the end of the review session, because we still have this for another hour practically. But yeah, what do you guys want to do for a little bit longer? Any questions, comments, concerns? We can make an agenda right now, turn this into a classic SI session. I don't have any more material for you guys. But yeah, questions, comments, concerns? Yes? Yes, of course, I would love to. So hydrocele of the testes. In the book, it talks about hydrocele of the testes, but essentially, like, we'll have, let's talk about here. So here, as the testes go down, like they'll kind of go, but in form, like this kind of canal type here, and this is our vaginal process, or processus vaginalis. Okay, if we get blood into here, it will no longer be a hydrocele, it'll be a what? Hematocele, okay? We'll see hydrocele in the testes occur, so a little bit lower, if what happens? What clinical manifestation would cause hydrocele of the actual testes? Anyone have an idea? No? Essentially, if we have some type of closure actually in our vas deferens and some of the tubes, I believe, we'll see hydrocele of the testes. And you know, if there's a rupture of any veins or arteries, then we see hematocele of the testes. Okay, but definitely check the PowerPoint. I know the PowerPoint exemplified on these very well. The book, not as much. But yes. And if I remember correctly from the PowerPoint, there was 6 examples of how we could have a hydrocele or hematocele, okay, and they all differentiated in location or whether it was blood or no blood. Okay, so I definitely take a look at that chart. And if you can pull up that chart, we can go over it right now. Anything else, or should I just go over study tips? Questions, Sam? Oh, the front page? Yeah, so for those who came, here. You're welcome. Anything else? Any other questions before I hit up some study tips? Yes. Awesome, yeah. So, yep, cool, thank you. So homologous structures. Let's actually, if you guys like, we can make that graph, okay? So, male, female, fetus. Okay, so what are some structures in the male? I know we mentioned in our worksheet already how we have the, let's see, where was it? So we have the Mullerian duct becoming the prostatic utricle. Okay, so Mullerian duct becomes prostatic utricle, which becomes essentially like the tissues for the uterus. What else? You know, like some of the easier ones, the penis is homologous to what in the female? Huh? The clitoris? Is that right? Okay, so then what else? What are some other homologous structures that we have here? You know, we have Gardner's duct, we mentioned earlier in some of our options. Will we find the Gardner's duct in male or female? Let's open up our book. What page did we say we found that stuff on? They're kind of all over the place. You know, you definitely have to work we'll have to work together. Okay, those who have the book to find all of those. Huh? Gardner's duct. So we'll see the Gardner's duct in females and the homologous syndrome, not syndrome, it's not a bad thing to be a guy, but the homologous structure in males would be what? Any idea? I'll let you guys look for that. But we also mentioned the Cowper's gland, aka the bulbourethral gland in males, which is homologous to what in females? Huh? Bartholin's gland, awesome. You know, we mentioned that also earlier. So the Bartholin's gland. Also the greater vestibule in females. Spectacular. What else can we add to our graph? Huh? Periurethral gland. Is that in males or females? Awesome. So we'll have our periurethral gland in females, and that's equal to what? The prostate. Awesome. Okay, we also mentioned earlier in the review, so this is the periurethral gland of Skene, right? Anything else? Do you guys have our fetus version of some of these? No, I know there's a good picture on page, what was it, 337, I think? Or 331? For the third edition. but it was a nice picture. It showed like how it looked like in the fetus, you know, kind of like that, and then it had the two arrows, and we see that it grew into the testes, and then this one grew into like the ovaries. That's a very rough diagram of that drawing. So what about Gardner's duct? We still have that one blank. Anyone find that one yet? Wolffian, awesome. So would that be for in the fetus? What about in males? The homologous structure in males. And we have a lot of brains working together now. Let's take advantage of that. They're all blue. All of them are from the Wolffian duct. If the Wolffian duct's blue, right? The Gardner's duct in the female. They're not all equal to each other, I don't believe. You might have to read a little bit in the page beforehand. Does it mention? What structures does the diagram express, like the picture show, like the three structures that the Gardner's duct looks like? It appears to be homologous to. Okay, at most the ductus deferens. Yeah, sure. Let me bring this up here actually. Share this with everyone. Thank you. What's your name, by the way? Izzy. Thank you so much, Izzy. So yeah, this is the diagram that I was talking about, right? So we'll see that our Wolffian duct in blue kind of separates, and we see the seminal vesicle, the ductus deferens, and the epididymis. Okay, but we actually have two blues here, the epophoron or epuphoron, and then the Gardner's duct. Okay, so here you definitely want to, you know, like kind of read a little bit more. But if I were to suggest just based off the diagram, it seems like the Gardner's duct is more homologous to the ductus deferens, while the epiphoron is more homologous to the seminal vesicle here. Okay, does everyone get that? So we'll write that down for now, but we'll confirm it later through our research, right? Okay, so let me use, so Gardner's duct in female was what was it? The vas deferens? Is that what it was? No, right? I'm sorry, I can't believe I forgot already. Ductus deferens, not vas deferens. That's a little bit lower. Ductus deferens, but let's kind of go on, and we mentioned the epuphoron was kind of synonymous to the seminal vesicle, right? Also, I know the wiki page has a really good, I think like I got the idea of this graph from the wiki page. Okay, so if you go to like Wikipedia and look up homologous structures of like the male and female, like they have a whole page just kind of talking about it, but then like a cool graph with it. So if someone wants to go to that, yeah? The appendix testes as well for in the male. So that's a new. What homologous structure would be in the female then? everybody can be looking and stuff. If you see a new structure that we could identify too as well, like we don't have to find the female homologous structure just yet, but like some other structures that we could keep adding to our list. So we have some people searching for one, some people searching for another, and we more effectively utilize our time. Unless you guys want to go on to a different topic. Yes? Awesome. Artery of ductus deferens is homologous to the uterine artery. Stuff like that is important. You don't want to forget your blood supply too. That changes for the male, right? We'll have the testicular artery and then the ovarian artery. Okay, so that's another one. The prepuce is homologous to the foreskin. Spectacular. So I'm going to add to the list back here. Okay. So we'll have the foreskin is homologous to the prepuce. Cool. So the fallopian tube. She said, I think, so make sure everyone else is double checking these answers, okay? Don't just like, write it down and copy it and start studying off of it exclusively. Oh, awesome. That is important. So labium minor or majora? Labium is equivalent to what again? The spongy? According to this Quizlet. The scrotum is labia majora, synonymous to the majora. Yeah. Yeah. So let's double check that one, okay? Yeah. Well, there is also the area like surrounding the urethra. That's essentially what it's probably describing. You had something to say? That's yeah, foreskin prepuce. Oh, yeah, so it's both in. Oh, yeah. No, females don't have prepuce. They're synonymous, not homologous. Good catch, thank you. Yeah, very good catch. So the vaginal artery is homologous to what? Inferior vesicle. So VESICL artery. Did I spell that right? Okay, so which one was it? Malarian? Awesome. Okay. Anything else? Yes? Oh, yeah, there you go. So clitoral hood, we'll call that. Is that what you said? Is that what you said? Cool. Just making sure. But let's go through these, just make sure anybody hasn't found anything new. We have the Mullerian duct turns into the prostatic utricle in males, and then the uterus in females. The penis is synonymous with the clitoris. Is that true? Yeah? The glans penis, right? Because the penis as a whole is kind of synonymous to the vagina, or homologous to the vagina. Is there something here? Oh, wow.
So yeah, it's like homologous. I mean, technically synonymous.
Gotcha.
Yeah.
Okay, so what Nicole just showed me here, looking back at the foreskin, so the clitoral hood is just another word for prepuce. Okay, and foreskin is just like the penile prepuce. Does that make sense? So it's like a hood that kind of covers. So we'll have, aka penis's prepuce. Good stuff. Good stuff. Okay, so going back down our list, so we have glans penis is homologous with the clitoris. Okay, so that's really important. Wolffian duct turns into the ductus deferens. Okay, along with a couple of other things in males, and then the Gardner's duct in females. Okay, we see the Cowper's or the bulbourethral gland turns into the Bartholin's gland and the greater vestibule. We see the prostate turns into the periurethral gland of Skene. The Wolffian duct also turns into the seminal vesicle and the epiphoron in females. The Mullerian duct also turns into the appendix testes in males, as well as the fallopian tube in females. The artery of ductus deferens in males is the uterine artery in females. We have the prepuce, or the foreskin of the penis, is homologous to the prepuce or the clitoral hood in females, okay? Then the spongy urethra is synonymous with the labia minora. Our resource for that one isn't the best, so you might want to research that one, but that does sound right to me. But then again, a lot of things sound right to me. Inferior vesical artery is homologous to the vaginal artery. We hit a lot of good structures here, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. There's still more, okay? We could keep going if you guys would like. Or would you guys like to talk about something else? Any other questions that you guys had? And just a reminder, I have these sheets all around. If you guys could fill those out, and leave them, don't forget about those. They help Sark out and people running a study union. You could just leave them on the table when you're done, and I'll come collect them afterwards. But yeah, and if you don't have enough, I have more up here. Any other questions? Suggestions for our homologous chart? No? Yes. Awesome, yeah. Go over the receptors and their functions. So we kind of talked about these receptors here. So if we go to page 591 in the 3rd edition, or some page close to it in the 4th edition, we'll see a little bit more, but let's kind of generalize each of these. Okay, so we discussed that the Pacinian corpuscle detects vibrations, okay, and similar feelings. Okay, what about Meissner's corpuscle? What kind of sensations do those nerves sense? Anyone? I don't have the book with them. Help our friend out. Should be page 591 or somewhere near there if you don't have, if you have the 4th edition, because this is the 3rd edition. Huh? Page, oh, go over number 55? Yes. Yeah, we're kind of elaborating on each of these now. So page 595 in the 4th edition. Awesome, thank you. So what about the Meissner's corpuscle? How would we describe that one in a quick sentence? You know. Yeah, yeah. Okay. Of course. Awesome. Cool, cool. So we could find them in a variety of places, like the palms of our hands, nipple and palms of the feet. What did you say about like the types of, not the types of cell. We'll find them in Schwann cells, right? Is that what you, flattened Schwann cells? What type of senses do they read? Okay, so for touch, right? So here, mechanoreceptors for touch. Will it be light touch? Will it be heavy touch? Does it elaborate? No? Cool. Okay, so mechanoreceptors for touch. Okay, and what about Merkel's disc? I'll just write that one here. And am I wrong in putting that L there? It's not in the book. Huh. Okay, well then let's skip that one for now. We know Pacinian corpuscle has to do with vibrations. What about Ruffini endings? Ruffinian corpuscle? Awesome. So they'll be found in the dermis, and they sense stretching. So when we have stretching of our skin, okay. What other mechanoreceptors should we take into account? We've discussed Meissner's corpuscle, Knott's Merkel's disc, Pacinian corpuscle, and Ruffinian corpuscles. Okay, hair follicle receptors. And those are kind of like easy to guess, but let's get an elaborated review. Awesome. So they're found around hair follicles. Awesome. But it helps with touch. So as the hair bends, so it senses like the bending of hairs. When those hairs touch. So those are our hair follicles. I believe there's one more, right? There should be like 5 or so. Awesome, yeah. Baroreceptors and chemoreceptors, those are kind of easy to remember. Like baroreceptors, I think of like a barometer. You know, you probably don't know if you've lived in Florida all your life what that is. Essentially, a barometer tells air pressure. Okay, here it's 1 atm, atmospheric pressure everywhere. Some places it might be important. Thus, where would we find baroreceptors in our blood? I'm sorry, dang, in our body, but then it's like, I already told you, in the blood. Yeah, thank you, Aaron. What about chemoreceptors? What would that do? Okay, cool. We sense like concentrations of various chemicals in our body. Okay, so one will take blood pressure, and then the other one will take chemical concentrations. Okay, baroreceptors, chemoreceptors, mechanoreceptors are like the main umbrella receptors. Any questions? No? Cool. What's next? Anything else you guys want to talk about? If not, I think I'm allowed to end the session now without like having to change my timesheet. But yeah. Questions? Come on, I'm here for you guys. Okay, this is the last bit. I know it's late. Okay, but yeah. Just to let you guys know, I won't be having any of my sessions throughout the week, unfortunately, just because, like, it'd be really difficult planning schedules out and stuff like that. I'd have to do like a whole new list because everyone's classes changed and my classes, finals change. But yes, good luck on Wednesday. Some study tips before you guys leave, okay? Study. Don't go partying tonight. I know you all want to, but it's not. You don't need to. Study. Super important, okay? And efficient studying, okay? Don't just sit and watch crash course videos on YouTube all night, okay? That's not gonna help you. It'll help you a little bit, but taking notes and then quizzing yourself, okay? Kind of consistently bringing that information from just your brain, okay? Also getting out distractions and whatnot. When I study, I always put do not disturb on my phone. I never study with that off, okay? What else? Finals week, a lot of people tend to disregard their health and whatnot, okay? Don't forget about your health. It's one final. You don't want to screw yourself over for the rest of your life, okay? Also, healthy body, healthy mind, okay? Connect the two. Exactly, yeah. No, don't do drugs or nothing to try and make you smarter or whatever. It might work, but it's not worth it. What else? Don't overdo it with the caffeine, okay? Kind of my strategy with caffeine, I know I've told you guys this before, at least those who's come to my previous reviews. I like to not drink coffee until the day before studying, or if I do a hardcore study sesh, I'll drink coffee, and then it's that Hail Mary, I'm not wasting my body, my tolerance to caffeine, drinking coffee every day. I might drink a green tea or something, but I'll drink a black, coffee when I really want to get stuff done. What else? Take advantage of resources, okay, but the best resources are your teacher's lecture notes and your book, okay? If you find stuff on, the internet, or a friend oh yeah, this person made this thing, those are good resources, as long as you don't find any conflicting material, then those are good resources, but those shouldn't be your primary resources, okay? Your primary resources should be the book and stuff, a lot of the times making your own, resources, making your own Quizlets and whatnot has proven very helpful for some people. And it's just the act of doing it. When I make some reviews and stuff, I know the information better just from making the review. You know what I mean? Any other suggestions that you guys have for acing the final? Maybe some specific test strategies, like you're there, you're in the test. What do you do? Anybody would like to share? No, you just go in and just, Ale? Okay, read the chapters twice. That's a good one. Yeah, what I would do is I'd read the chapters like once, just all the way through. I wouldn't read it a second time, but I'd go with the information, I'd go with the PowerPoints, and then like add on to the PowerPoints referring to the book. So I like skim through the book a second time. But yeah. Mm. Awesome, yeah. So go over all the clinical points. That's key, okay? I remember like the secondary class, he's like, the blue is the most important part of the book, okay? Mm-hmm. Gotcha. Cool, so like kind of predicting your grade. Yeah, so predicting your grade, you might want to like tick, maybe on your hand or the bottom of the scantron or something. Yeah. Just some classic study strategies. If you don't know the question, skip it. Don't waste your time. Ask if you don't understand something, if the question sounds weird, raise your hand and ask about it. Because sometimes like a TA, if you get a TA, they'll give you a little bit too much information, you know what I mean? So if you have struggle with a problem, be like, oh, what did you mean by this? And they're like, oh, that's this, and they might, Freudian slip some info to you, you know what I mean? That was a little cheat code right there. But yeah, I don't know. I guess that's it. Thank you guys for coming. If you didn't get a sheet, I have more sheets here, but there's sheets lying around. Yes. Damn, you should. Yeah. I don't know the number. I had it on a sticky note, but I thought it was like just trying to tell me what my name was. And I'm like, I know that. But apparently there's like a session number. Oh, yeah, that sucks. But yeah, just forget about it, I suppose. Yes? Which one? Yeah, of course. Here's the first page of answers. But yeah, if you have any like questions you want to come up and ask me, I'll be here for a little bit. Thank you so much for coming. Good luck on your test, okay? And y'all can probably study here too. I don't know when this place closes. But yeah.